I started to knit, and I knit for the 20 or 30 years. And then last year I decided I wasn't too old to learn something new, so I decided to learn to crochet. Well, I suddenly found that it was this hand. I couldn't open up these two fingers. They would click and close, and then I would have to take this hand and open it. And I decided I better get my hand fixed. So I went and asked the doctor, and he said, the tendon's supposed to come over the top of that joint and stay there. And when I tell that finger to move, it moves. Well, my tendon had slipped into the joint, this one and this one. So I thought, geez, I've got a lot of life ahead of me. I better get it fixed. So I did. And also, I was so frustrated. I'd go to wash my hair, and I couldn't use my hands. And getting hold of a knife and a fork, I was so frustrated. Buttons, just all those things that you just do all the time. We have physical therapy here at Medford Lee's, but they're not the specialists in hands, and I wanted to be sure that I got them working.
So Helen's first visit, she came in and she was a little scared, having some pain, was a little frustrated with her inability to use her hand because she had lost her ability to grasp with that hand, which meant she couldn't no longer knit. The goals that we set for Helen were to be able to use a knife and fork again. We also had set up a goal for her to be able to knit again, because that was a big part of her life, and being able to give back to her community. It was a lot of education with her. She wants to know how things work and why we're doing certain things. She had significant weakness in her hand. She actually had a carpal tunnel release along with the surgery to her hand. Just also being able to do some things to help her achieve her goal to regain her ability to knit again was one of the big things that we worked towards. She was able to return to knitting. She was able to cut at her food for meals and open her jars and manipulate objects the way she did before.
This is just about 4 or 6 months ago. Look what I can do. I feel very lucky that now I can do almost anything with my hands. I'm very happy with what I got, and I'll tell anybody,